I recognize the honourable member for Halifax Citadel Sable Island.
Madam Speaker, my question is for the Minister of Health and Wellness. I'm sure the Minister is aware that yet another family doctor is set to leave the Halifax Citadel riding on November 2nd, just 2 years after they started practicing. Some residents with a 25 or 30-year history with the clinic in question were told Friday that there was no longer a doctor for them there. They called 811 to join the wait list, only to be reminded that there are 160,000 people ahead of them. Can the Minister please explain to the hundreds of my constituents who will lose their attachment to primary health care in the next month this failure to retain the family doctors that we need?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. I thank the member opposite for the question. So certainly, when we do know that physicians are retiring or moving away from their practice, we work very hard to work with the practice in order to stabilize it. So I don't have the particular circumstances around this clinic, but certainly Nova Scotia Health will reach out to the clinic to understand the circumstances. For people who do put their names on the Need a Family Practice Registry, it's important for them to know that they have immediate access, that they will be able to have virtual care Nova Scotia, that they will have their recent records on their phone, that if they need to be seen in person, they will go to primary care clinic, which is located near them, that we have primary care clinics and pharmacies, and there are 840,000 new appointments in this province on an annual basis to support people in access to care.
I recognize the honourable member for Halifax Citadel Sable Island.
Thank you, Madam Speaker. And I think it's really important in this case to point out that this is not a case of a doctor retiring, but it's actually a relatively new doctorate practice. So the question is, why aren't they staying? This isn't an isolated incident in my riding. Halifax Citadel has the highest percentages of residents on the Need a Family Practice waitlist in June 2020. In June of this past year, which is the most recent data we have, 22.9% of residents were waiting for a family doctor, and I'll table that. The solutions like making a phone call, one-off appointments, apps are not sufficient to cover the massive gap between the level of primary care that is needed and the level of primary care that is currently available. How much longer is this government going to make the residents of Halifax Citadel Sable Island wait for actual primary care attachment?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. And what I want Nova Scotians to know is that primary care is changing in this province. In the old days, we did have a doctor for every Nova Scotian. Now we will have a health home for Nova Scotians where people are attached to clinics, where they can see a variety of different care providers working to the full scope of their practice. We are building these teams across the province, and when we know that someone is leaving or retiring, we work very hard. There's been over 80,000 people who have been attached to primary care providers since we formed government. There are a number of individuals who've also been connected to chronic disease care, as an example. For prenatal care, there are a variety of different options for Nova Scotians who are looking and seeking primary care, and I would encourage those patients to call 811 to help with the navigation process.